I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. We're sitting here on the 5th floor, the two Dr. Wises, Dr. John and Dr. Rhandi Wise and I, in the fitness center, the wellness center. And we've been talking briefly about what I'll describe as getting upstream in your life on your health and wellness. What are things that you can do, and how can your physicians, who are experts in that field, help you prevent some of the things that happen to people that are very preventable, or you can diminish the effects of things that do happen to people so that you can survive in some cases and thrive, have the lifestyle you want, be able to travel, do things with your family, whatever it might be, that you have the health and strength to do it. One of you want to jump in on this subject of?
Sure. And definitely in our specialty, it's very important to get your annual checkup with us. There's several different conditions we can help prevent or at least catch early, especially breast cancer. And here at the Wellness Center, we do have a radiology department that we do mammograms, screening mammograms, diagnostic mammograms, and it's very important to get every year starting at age 40. And then as well in our clinic to help prevent cervical cancer by screening with pap smears. The guidelines have changed over the last few years, but it's very important to stay on top of that. And especially with the pandemic, I think people have kind of been a little bit laxed on getting their annual care, but it's very important. We do a comprehensive and make sure that you're getting your colon cancer screening, getting your thyroid checked, different labs, different endocrine processes that could go wrong that, we do check on, and it's very important to do yearly. And whether it's not, whether there is a primary care that is associated with a patient, we make sure and try and accommodate that and get them with a primary care doctor to help,
Right.
No, I think to speak to your point, I think a lot of ladies sometimes maybe the only doctor they see is their OB-GYN, right? And so, and we kind of, I think, take pride in that as well, and handling preventative care, and if you need to see a primary care such as a family medicine or internal medicine, we can get you in those pipelines. But speaking to that, of course, the annual exam, and then I think one big thing that is, I'd say, relatively new is the HPV vaccine. I'll say, certainly within the last few years, we've actually expanded that. So it used to be from 9 to 26-year-olds, and now they've expanded that to 45-year-olds. And largely that was due to the success they saw at decreasing cervical cancer rates. And I think that's just going to continue. And so, everything from vaccines to your preventative, to your mammograms, to your pap smears, all very important. And then even once you reach the age threshold where you don't need a pap smear, just coming in once a year just to get an exam. There are other different preventative measures and just general health things that we certainly can address and will address. And again, big part of our job is preventing these things before they become diseases or become serious diseases.
Thank you for both of you for being on our little show here today. Dr. Rhandi Wise and Dr. John Wise, OB-GYN physicians. Thank you.